When people hear the words lung cancer, they often imagine something sudden and obvious: strong pain, constant coughing, or a clear moment when the body sends a warning. But lung cancer usually doesn't begin that way. In most cases, it starts quietly, at a level we can't feel, long before symptoms appear. Understanding how it begins can remove much of the fear and replace it with clarity. Lung cancer is widely discussed but rarely explained in simple terms. Many people know the name but not the process behind it. This lack of understanding often leads to fear or false assumptions. Learning what lung cancer actually is and how it starts helps people think about lung health in a calmer, more informed way. In simple terms, the lungs are soft, spongy organs whose main job is to bring oxygen into the body and remove waste gases. Every breath travels through a system of airways that branch again and again, ending in millions of tiny air sacs. These air sacs pass oxygen into the blood, fueling every cell in the body. To do this job, the lungs rely on healthy cells that line the airways and air sacs. These cells are constantly exposed to what we breathe in. They repair themselves, replace damaged cells, and adapt to minor irritation. This process works well most of the time, but it also means lung cells are under constant stress. The cancer. Lung cancer is not an infection, and it does not appear overnight. It is a condition where some lung cells lose control over how they grow and divide. Normally, cells follow strict rules. They grow when needed, stop when the job is done, and die when they become damaged. In lung cancer, certain cells stop obeying those rules. They continue multiplying even when the body does not need them. Over time, this uncontrolled growth can form a lump of abnormal cells, called a tumor. Not all tumors are cancerous, but cancerous tumors have the ability to invade nearby tissue and interfere with normal lung function. Lung cancer includes several types, each behaving differently, which is why no two cases are exactly the same. How lung cancer begins. Lung cancer usually begins with repeated damage to lung cells over many years. Every time harmful substances enter the lungs, such as smoke, polluted air, or certain chemicals, they can slightly damage the DNA inside lung cells. DNA acts like a control center, telling cells how to behave. The body has repair systems designed to fix damage. But when damage happens again and again, those systems can fail. Small errors begin to build up. Over time, these errors change how cells respond to normal signals. Some cells no longer stop dividing when they should. They don't die when damaged. Instead, they continue growing, quietly and unnoticed. This is how lung cancer begins, slowly, invisibly, and often without symptoms. Why the lungs are at higher risk than many other organs. The lungs are unique because they interact directly with the outside environment. Every breath brings in oxygen, but it can also bring in irritants and toxins. Unlike organs protected inside the body, the lungs are constantly exposed. Smoking is one of the most well-known sources of lung damage, but it is not the only one. Secondhand smoke, air pollution, radon gas in homes, workplace dust, and chemical fumes can all irritate lung tissue over time. This ongoing exposure increases the chances of long-term cell damage. It does not mean everyone exposed will develop lung cancer, but it does explain why the lungs are especially vulnerable. Changes most people never notice. In the early stages, lung cancer is usually silent. Abnormal cells are too small to cause pain or breathing problems. The lungs can continue working normally, even with small areas of damage. The body is also good at adapting. One part of the lung can compensate for another that isn't working perfectly. This is why lung cancer can grow for years without noticeable symptoms. As cancer grows, it may begin to irritate nearby tissue or affect airflow. Symptoms such as a lingering cough, mild shortness of breath, chest tightness, or frequent lung infections may slowly appear. These signs are often subtle and easily ignored. Who is more likely to be affected? Lung cancer can affect anyone, but certain factors increase risk. Long-term smoking remains a major risk factor, especially over many years. However, people who have never smoked can also develop lung cancer. Environmental exposures, family history, age, and overall lung health all play a role. Risk increases with age because cell damage accumulates over time. This is why awareness is important even for people who feel healthy. Common myths that create confusion. One common myth is that lung cancer only affects smokers. Another is that it always causes early, severe symptoms. In reality, lung cancer often develops quietly and can affect people from many backgrounds. There is also the belief that lung cancer always leads to the same outcome. Medical advances in screening, imaging, and treatment have improved how lung cancer is managed, and outcomes vary widely depending on many factors. So in the end, learning how lung cancer starts is not about creating anxiety. It is about understanding. When people understand that lung cancer develops slowly, they can appreciate the importance of prevention, awareness, and regular medical care without panic. Reducing exposure to harmful substances, maintaining healthy indoor air, and speaking openly with healthcare professionals are part of long-term lung health awareness. Lung cancer begins as a slow, invisible process inside the lungs, often long before symptoms appear. It starts when repeated damage changes how lung cells behave, allowing them to grow without control. The key message is not fear, but understanding. Knowledge brings clarity, and clarity supports calmer, smarter health decisions. When we understand how lung cancer begins, we are better equipped to care for our lungs over the long term. With that said, let us know what are your thoughts under the comments section, and we do our best to read and replay. Thank you for watching.